common procedures that's requested among patients who have symptomatic issues is actually breast reduction. And I would say that for my patients coming with breast reduction, it's most often not just because they want to aesthetically reduce the size of their breast for appearance sake, but really that they've had a lot of symptomatic problems such as neck pain, upper back pain, shoulder pain. Some patients have told me that, as they've had large breasts maybe their whole life, their shoulders have sort of rotated forward and they kind of feel hunched over. And those are all, very common symptoms I see for patients who have very heavy breasts. The range of patients where I've seen for breast reduction really varies. I mean, I've seen patients with really, really large breasts and some who are just a little bit heavy, such that it's giving just not really severe symptoms, but sort of nagging, constant, annoying symptoms. The goal of breast reduction surgery is really to improve those symptoms. And so what I tell patients is we're really going to try to reduce the size to make the symptoms better, and at the same time give a lift and make the breast, of course, look aesthetically appealing, because after all, it is plastic surgery. So we like to make people look nice at the end. But the goal, as I tell patients, is really just to make them feel a little bit better. Overall, procedure works very well. Patients really get a very nice benefit with regard to their symptoms. I can't remember the last breast reduction patient I've had where I've done the reduction. They didn't say I feel amazingly better. The symptoms are gone. The pain is reduced. I'm very happy. Best candidates for the procedure really are patients who have had large breasts and really specifically can tell that it's the breasts that are causing those problems. While we can usually tell ahead of time that patients will be improved with the breast reduction surgery, occasionally we get the patient for whom it's not really completely clear, and so in that case, really consultation can really kind of delineate whether that's a good idea or not. Procedure itself, there's a couple of different ways to do the breast reduction. There is what's called a Weiss pattern or inverted T breast reduction, which is basically an incision around the areola, down to the fold from the areola, and an incision down underneath the breast. Reason we make those incisions is because with breast reduction, in addition to the breast tissue being too big, the skin has been stretched out by large breasts. And so in addition to taking out the breast tissue, we do want to also remove a lot of the breast skin, very similar to what we do for a breast lift. And so that's why for all my breast reductions, I will incorporate a breast lift technique into it so that the breast is also lifted as well and gets a nice rejuvenated appearance. It's sort of a bonus in addition to getting the reduction. In certain patients who have less extra skin or who have less of a breast to reduce, there are other ways to do it. You can do what's called a vertical breast reduction, which is an incision sort of around the areola and downward. Some people call it like a lollipop incision. And it really, again, depends on the degree of breast tissue that needs to be taken out and the degree of excess skin. So that's something that I would assess in consultation with a patient. I usually am pretty careful to make some very specific measurements that I like to make because those measurements kind of help tell me which method will work the best and how I can sort of individualize the plan for surgery. And as always, all the plans have to be individualized because people really do have a lot of differences. Very often, as part of the individualization, I do see that patients who need breast reduction have pretty asymmetric breasts. One side is significantly bigger than the other, or for example, one nipple may be significantly lower than the other. And of course, the goal of surgery is to really make this closer as much as we can to the degree that's possible. Surgery itself, depending on the technique, usually lasts about 3 hours or so, done under general anesthesia. Patients sleep the whole time and it's more comfortable for them. Again, quite straightforward procedure. The goal again being to reduce the skin and excess breast tissue. After the procedure, I have the patients in some sterile dressings and a special surgical bra that I put on at the time of surgery. I have patients leave that on until the first post-operative visit when I see them, usually within that first week or so. Then I'll take off the dressings, double check for signs of infection, and things like that. Occasionally in some patients I will use drains, which are basically where you have some tubes that go into the tissue to kind of remove any excess fluid that remains. That really I do on a case-by-case basis depending on how things go during the operation. After surgery, what patients can expect is bruising and swelling, a lot of it to go away in the first 2 weeks or so, but really for the majority of swelling really go away by 6 weeks. And the breasts do continue to remodel and get better in terms of shape from the 6 weeks to about 6 months to a year really. And by that time a lot of scars have faded as well. Scars, as always, do kind of peak in terms of their darkness, I'd say about 4 to 6 weeks after surgery, but afterward you start this slow whitening or sort of lightening process that goes on for the first 12 months. Overall, breast reduction, like I said, works very well for patients. Again, the goal really is a symptomatic improvement, usually in back pain, neck pain, and I find my patients are very happy with it.